Hey everybody, this is Dr. Jordan Adrian with Limitless Concierge Physical Therapy based here in Denver, Colorado. Just want to take a moment this morning to answer some of the questions that we get asked all the time as physical therapists, which is should I use ice or heat? And it really kind of depends. A lot of times after an acute injury or a surgery, we were taught the PRICE model, which is to protect, rest, ice, compress, and elevate. Now, within recent years, one of the main researchers that came out with that suggestion has actually kind of recanted that a little bit after further research and data surface. And it's may not be quite as beneficial to ice consistently as we had been previously taught after an acute injury or a surgery, as that chronic icing can inhibit some of the natural inflammatory processes that occur and are the first step in working towards the healing process. Now, with that being said, I always talk to people about being able to get their pain down to a manageable level. We don't expect your pain level to be zero after a surgery or after being in an accident or having an acute injury, but it should be at a level to where you're able to sleep comfortably at night without waking up every 20-30 minutes to get up and move around. So we want to find a good balance between keeping our pain level in check, and this may still involve icing infrequently for the first few days after a surgery or acute injury, and then quickly weaning off of that so that your body can move on to that next stage of the healing process. Now, with regards to heat, typically we're not going to be heating an injury, especially not directly over an acute injury or a surgery, an area where you had surgery, as there's already quite a bit of swelling in that area that's putting pressure on some of the adjacent tissue and nerves. However, we do find really good benefit from using heat as well as stretching in events where you're having an episode of cramping or muscle discomfort. Now, with that being said, is that heat going to penetrate down more than a couple millimeters into the skin and really impact any healing that goes on down below that surface level? That doesn't necessarily seem to be the case. But like I said, if you're dealing with muscular pain and cramping, it can be a great way in order to help to start to relieve some of that tension in through there.